Welcome back. This is session 3 of NURS 238, classification of management of mental disorders, and we're this time going to look at mental retardation. At the end of the session, the student is required to define mental retardation, identify the levels of mental retardation, explain other forms of mental retardation, explain some causes of mental retardation, manage a client with mental retardation with the nursing process, and discuss some methods of preventing mental retardation. So, mental retardation, otherwise called mental subnormality. The term mental subnormality is used to denote a condition of retarded, incomplete, or abnormal mental development present at birth or early childhood, and characterized mainly by limited mental retardation, mental handicap, and mentally challenged. Mental retardation varies in severity: mild, moderate, severe, and profound. These categories are based on the functioning level of the individual. So here I just want you to know that other terms used to describe mental retardation are mental retardation, mental handicap, and mentally challenged. The categories are based on the functioning level of the individual. I want to look at the varieties in severity of mental retardation. The first one is mild mental retardation. This is approximately 85% of people with mental retardation are categorized as mild. The intelligence quotient here score ranges from 50 to 75%. They can become fairly self-sufficient and in some cases live independently with community and social support. The next level is the moderate mental retardation. They are also called imbeciles. About 10% of the mentally retarded population is considered moderately retarded. Moderately retarded individuals have IQ score ranging from 35 to 55. These children are considered trainable, but only simple tasks can be accomplished with moderate supervision. Communication skills do not develop adequately, and social isolation results. Occupational and self-reliance tasks are achieved only with supervision. The third level is the severe mental retardation. Severely retarded individuals have IQ score of 20 to 40. About 3 to 4% of the mentally retarded population is severely retarded. Speech and motor development are poor. Self-care may be possible through behavioral training. An institutional setting is usually required for management. The final level is the profound mental retardation. Only 1 to 2% of the mentally retarded population is classified as profoundly retarded. Profound retarded individuals have IQ score under 20. Language may not exist and motor skills are severely impaired. Lifelong constant supervision and nursing care required. They are totally dependent on others for survival. All people with mental retardation may demonstrate low frustration tolerance, hyperactivity, aggression, self-injurious behavior, and affective instability. What are the causes of mental retardation? In about 35% of cases, the cause of mental retardation cannot be found. This is by Wiedebeck 2001. Biological and environmental factors can cause mental retardation. First, prenatal causes or causes before conception. About 5% of mental retardation is caused by hereditary factors. Mental retardation may be caused by an inherited abnormality of the genes, as in Huntington's chorea. Heredity may also be chromosomal abnormality, example trisomy 21. We'll look at this later. Age of mother. Very old or very young mothers have risk of having subnormal children. Age of mother should be over 35 years. So if the age is too less or too high, that is above 35, there's a likelihood that the woman will give birth to a subnormal child. Then mental disorder in one or both parents. So if one or both parents have mental disorder, there's the likelihood that they could give birth to an individual suffering from mental retardation. During conception, maternal malnutrition, so if the mother doesn't eat well, it affects the baby in utero and can cause mental retardation. Intrauterine infection can also cause that. Examples are syphilis, rubella, and herpes virus. Teratogenic drug in maternal medication during pregnancy, especially during the first trimester, can also cause mental retardation. Examples are maternal alcohol abuse, narcotics, example cocaine, hydantoins, example phenytoin, streptomycin, tetracycline, and maternal smoking are some of the teratogenic drugs that, when the woman is pregnant and takes it, can affect the baby in utero and consequently give birth to an individual suffering from mental retardation. Then the perinatal causes, or during childbirth, when the child is being born, problems like obstetric difficulties, asphyxia neonatorium, birth injuries, low birth weight, prolonged or difficult birth, cord prolapse. These are some of the things that can cause the baby to suffer from mental retardation. Then we have postnatal causes, especially within the first 5 years of life. And this includes neonatal diseases, infections, accidental trauma, poisoning from lead found in paint and mercury. Social causes include environmental deprivation, example, deprived parent on isolation for a long time. Some specific forms of subnormality. The first one I want to talk about is Down syndrome, also called Mongolism or trisomy 21. This condition was first described by Landon Down in 1887. In Down syndrome, because of a biological error around the time of conception, the cells come to have one extra chromosome, that is 47 instead of the normal 46. The presence of an extra chromosome in the cells interferes with the normal development of the brain, leading to mental retardation. The individual inherits an extra chromosome on the 21st pair. It is often possible to recognize people with Down syndrome by the following features. They have a broad nose with poorly developed bridge. The nose is flat. They have a small round scar with its back flattened. They have a large tongue which protrudes out of the mouth, has only one palmar crease instead of two. Their limbs are short. They have short fingers with squared palm. They have short and thick neck, and they are prone to respiratory tract infections, congenital heart diseases. These children that suffer from Down syndrome are alert. They are happy, affectionate people and lover of music. They have IQ between 25 and 50. The next form of mental retardation or type is Klinefelter syndrome. The affected person inherits an XXY chromosome. The syndrome is usually recognized at adolescence. Clinical features of Klinefelter syndrome include a girlish voice, testicular atrophy or degeneration, tall angular build, gynecomastia. Gynecomastia is she has very big breasts. Meanwhile, she's not a girl, she's a male. We call it gynecomastia, and they are prone to mental illness. The next is Turner syndrome. Turner syndrome, TS, is a genetic condition that only affects females. The condition is caused by a missing X chromosome. Turner syndrome affects about 1 in every 2,500 baby girls. Turner syndrome was named after Dr. Henry Turner, who discovered it in 1938. Common names of Turner syndrome include monosomy X, gonadal dysgenesis. And then we have phenylketonuria, otherwise called PKU. This is an inherited metabolic disorder in which there is the absence of the enzyme phenylalanine hydroxylase, essential for the oxidation of protein, phenylalanine into tyrosine. Phenylalanine thus accumulates in the bloodstream and eventually damages the brain. Phenylalanine is excreted through the urine. Clinical features of phenylketonuria includes the child is normal at birth, signs of slow growth begin to show in infancy, epilepsy is common in PKU, and PKU patients are overactive and twitchy mannerisms are also present. Treatment. How do we treat phenylketonuria? Early detection through screening of all newborns. Special diet, low in phenylaniline diet. Phenylaniline hydroxylate preparations are administered. And finally, we have kernicterus. This is a disorder that is due to severe jaundice in the newborn with deposition of the pigment bilirubin in the brain that causes damage to the brain, potentially leading to attitoid cerebral palsy and mental retardation, also known as bilirubin encephalopathy. Clinical features of kernicterus is severe jaundice, twitching, fits, vomiting, deafness, and epilepsy. What are the common health problems associated with all the mental retardation? One is restlessness, continuously moving around, unable to sit at one place. So mentally retarded patients, most of them cannot sit at one place. They are so restless. They have poor concentration and they are very impulsive. They throw temper tantrums, they are irritable, and they can cry easily. They have what we call head banging. They bang their head on the wall. Even though it's paining them, they don't stop. And then they have repetitive rocking. They sit on the floor like the way the yoga people sit on the floor, and they rock themselves. We call it repetitive rocking. How do we care for patients who suffer from mental subnormality or mental retardation? Physical care. Provide normal and balanced diet rich in vitamins and minerals, except in phenylketonuria, where a special diet rich in the enzyme phenylalanine hydroxylate, and you can get this one from liver. Assist the patient in feeding, assess the physical deformities and intervene appropriately. Self-prescribed drugs for symptomatic care, example, anticonvulsants for people who show attacks of epilepsy. Note side effects and nursing implications of drugs served. Tranquilizers may be given for aggressive behaviors to calm them down. Surgery for removal of space-occupying lesions if required. That is, provide neurological nursing care. Assist in self-care and other activities of daily living. Protect the patient from injury. Institute nursing observation as condition demands. Example, temperature, pulse, respiration, fits, bowels, etc. And provide physiotherapy. Psychological care of subnormal children. Provide psychotherapy, example, group therapy, behavioral modification therapy to correct irresponsible behavior, example, head banging, incontinence, and aggression. Maintain therapeutic relationship. Provide environmental stimulation. Reassure family and relatives. Provide emotional warmth. Assist to develop self-esteem. Social care for subnormal patients. Emphasis on community-based care. And we have one in Jaulu. We have one in at Cantonment, the New Horizon School. Then we have one in Dansoman, and we have Awawa too, and others. Provide special education opportunity, occupational and recreational therapies, which is key. How do you prevent subnormality? So prevention, primary prevention of subnormality, that is health promotion and specific treatment. Good obstetric care, meticulous antenatal care, regular antenatal checkups, immunization, amniocentesis, ultrasound, etc. to detect any chromosomal abnormality and also to determine whether a fetus is developing normally in the womb. Genetic counseling is so important. You also need to do blood tests for venereal diseases. Avoidance of alcoholism, smoking, drug abuse, avoidance of teratogenic substances and radiation, adequate monitoring of mother and child, premature baby care, prevention of accidents and injuries, adequate feeding of nutrients to child to prevent metabolic disorder, better housing and living conditions for children, and utilization of family planning services. Secondary prevention, early diagnosis and prompt treatment, early detection of diseases like metabolic hormonal disorders and providing prompt treatment, early intervention and training of child by physiotherapy, training of child for self-help skills, specialized schooling, provision of family support, training of behavior modification techniques, example, positive reinforcement, and finally, tertiary prevention of subnormality, disability limitation, and prevention of complications. Here, do vocational training to develop vocational occupational skills and social skills to reduce disability and provide optimal functioning, and provide adequate rehabilitation services in the community. How do we diagnose mental retardation? Amniocentesis for pregnant mothers to detect chromosome abnormality, EEG to exclude seizure, MRI should be done, CT scan to study structural abnormality of the brain, physical examination to exclude physical illness. You also do the Westler Intelligence Skill 3 for school-age children, Stanford Binet test for young children who are at least 2 years and above. So these are the references for this session, and I expect you to read to learn more about mental abnormality. Thank you.